Kyriakis.
Yes.
Come on in. How are you today?
Good, thank you.
That's good. Take a seat, Mary.
Thanks.
Mary, my name's Cindy and I'm going to be your physiotherapist for today. Now, I'm also a first year student at Charles Sturt University studying physiotherapy.
Okay.
So, are you okay for me to go ahead with your assessment today?
Yeah.
Yes? Great.
Yeah.
Great. So, have you been to see a physiotherapist before?
No.
No. So, do you know what a physiotherapist does?
No idea.
Okay, so Mary, a physiotherapist will assess you and your individual needs and diagnose the problem with what's going on with you. So, what's brought you in here today?
I've got a really sore hip.
Okay, we'll have a look at that and we'll do our best to try and get you better again. So we'll work out a program that will suit you and your needs and get you better. How does that sound?
That sounds great.
Okay, great. Now, I'm just going to write down some notes as well as I go along.
Yeah.
So, with your hip pain, what sort of pain would you rate it as being out of a 1 to 10 scale? 1 being very not too bad and 10 being really sore.
I'd probably give it a 4.
A 4 out of 10? Okay, so
Yeah.
it's not too bad. Okay.
Yeah.
So when you say a 4 out of 10, what sort of pain are you experiencing? Like a aching? Or...
Yeah, it's a really big ache, nagging sort of ache. Yeah.
Okay, is it like sort of deep or is it dull?
I can feel it right in there, like it's pretty deep.
Okay, no worries, Mary. Now, do you have any other pain in any other area?
Yeah, I do. I have pain in my groin, my lower back and my thigh as well.
Okay, so you say you got pain in those areas. What sort of, out of 10 again, what would you say would be on the scale?
For the groin,
For the groin? Yeah.
it's like an 8 out of 10.
Okay, so that's really bad then.
Yeah, it's
Okay.
just giving me a bit of grief.
Alright, now, and you said you got pain in your lower back as well. So
Yeah,
what
I
sort
do.
of pain would you rate that out
It's
of?
not so bad, it's like a 3.
A 3 out of 10. And your thigh?
It's like a 6, so yeah.
A 6 out of 10. Okay, so the pain's pretty much radiating down the front of your body then. So let's see what we can do. Okay, now have you had any treatment prior to coming here from a doctor or another physio? So you said you haven't been to a physio before.
Yeah.
So have you been to the doctor at all?
No, haven't, no.
No doctor. Okay, Mary. So prior to the hip pain, were you walking okay? I noticed you had a bit of a limp coming in.
Yeah, I've been using a walking stick now, but before that I was fine.
Okay, alright, no worries. So have you had any surgery in the past for anything at all? And if you have, what have you had done?
I have had surgery. I've had a hysterectomy. That was
yeah.
like 10 years ago from memory.
Yeah.
And I also had my gallbladder removed about 5 years before the hysterectomy.
Alrighty. Are you on any medications at all at the moment?
Yeah, so I take Covasil. I think it's for my high blood pressure.
Oh, okay.
Yeah.
So have you seen a doctor about that or you're on
Yeah.
prescribed from the doctor?
Yeah, prescribed from the doctor.
So you have blood pressure, high blood pressure?
Yeah, I do.
Yeah?
Yeah.
And it's Covasil, you said.
Covasil, yeah.
Okay. Is there anything else I should know? Any other medications?
Well, I have diabetes as well. So I'm taking Diabex and Diformin for that.
Okay, so going off that, you have diabetes type 2, is that right?
Yeah, type 2 diabetes.
Okay, no worries, Mary. Okay, so do you have, I'm going to ask some other questions, just something that I have to ask you. Do you have any problems with your bladder or bowels at all?
No, I mean, I go to the toilet at night like twice. I wake up to go to the toilet, but that's normal. I've done it my whole life, so.
Okay, yep.
Yeah.
Okay, so are you getting up any other times through the night since you've had hip pain at all?
Yeah, so the hip pain's disrupting my sleep quite a bit.
Okay.
I wake up an extra 2 times a night.
Okay.
With that.
All right. Have you had any unusual changes in your weight?
Oh,
in the last couple
no.
months?
No.
No changes in weight?
Yeah. unfortunately. I do want to get a bit thinner.
Okay, well we can work on that, Mary, if you like.
That would be great.
And okay, now I've got a few other questions I need to ask you about your, like, do you work?
I do. So I work in a private hospital.
Okay.
I'm working 4 hours a day, 5 days a week.
Right, okay.
I'm cleaning there.
Oh, you're a cleaner. Okay, so
Yeah.
does that aggravate your pain?
Yeah, lots of bending forward and just lots of hours on my feet. So
Oh, that's no good. So
yeah.
are you able to cut back at all?
I did look into it, but my husband's on a disability pension,
Oh, okay.
and so he doesn't have an income. So I've really got to work to keep the family
Okay.
supported. Yeah.
Now I'm going to ask you about your house, your living arrangements. Do you have any stairs or anything at home that you have to use?
Yeah, I do. So my house is 2 stories, but to get into the house, both the back and front doors have 8 steps going up to it.
Okay.
And then once inside, all the bedrooms are on the top floor.
Right.
So I've got to walk up a set of stairs.
Oh, okay.
Yeah, a bit of a struggle.
Okay. So and that takes a fair bit. That takes time to get up and down, and that really hurts.
Yeah, it really has. Yeah.
All right. Well, we need to work on getting you better so you can get back up and down the stairs.
That would be great.
Okay. Now, Mary, what helps ease the pain?
So if it's really bad, I'll take some Panadol. That's normally my last resort.
Yep.
Because I don't really like taking extra medication.
Mm-hmm.
But when it starts getting sore, I'll lay down if I can, if I'm not working.
Yep.
And I'll rest on my back or my left side because the right sides do sort of lay on. So
Okay.
do that. And generally I'll have a hot shower and put a heat pack on it.
Okay.
That tends to help, yeah.
All right. So when you say you take Panadol, how often are you taking those a day?
Oh, like just whenever it gets sore, I'll take 2.
Okay.
Generally it helps. I normally take it at night time when I'm going to bed.
Okay.
Yeah.
All right. And with your pain, does it generally get better throughout the day, or does it get worse?
It gets worse throughout the day.
It gets worse throughout the day. That's no good.
Yeah.
Okay. So now, what sort of activities do you have? Any hobbies, activities that you like to do that you'd like to actually keep doing?
Yeah, well, I really like gardening. It's one of my greatest hobbies that I do.
Okay. Yep.
So I don't want to give that up, but I am finding it really difficult at the moment to keep doing it. But I also like to walk my dog, and my dog needs exercise, and my husband obviously can't do it. So yeah, I've got 3 sons. They're useless.
That was my next question. Do you have anybody in the area that can help you out a bit?
Yeah, they don't do anything. So I've got to keep walking my dog because no one else will do it for me.
Okay, maybe we need to turn that around with the boys.
That would be good. Yeah.
So in saying that you've got your sons living at home, do they do anything to help you out at all?
No, they eat and sleep, and that's all they do.
Okay, so you're doing all the washing and cooking
Yeah.
and cleaning and everything.
Yeah.
That's no good. No good at all.
You're telling me.
Okay, Mary, so what sort of things would you like to get out of today's assessment? Like, what do you want to happen out of today?
Well, ultimately I do want to relieve my pain. I just
Yep.
want to stop having pain in my hip.
Okay.
But yeah, I want to be able to eventually walk my dog and be able to garden and walk without my walking stick. That would all be really good.
Okay.
Yeah.
Let's see if we can get working on those things.
Yeah.
Now we'll get you definitely get you back to walking your dog.
Perfect.
Yes, the dog needs exercise too.
Yes.
And as you were saying, you want to keep your weight down, so
Yes.
we can work on that. Any reasons that might stop you from coming to your physiotherapy appointments?
Well, my job, it goes from 11 to whenever I'm done. And it's 4 days a week, 5 days a week. So that will probably affect when I can come.
Okay, so how about if you start work at 11, so you finish maybe around 4 or 5 o'clock in the afternoon. Okay, so if we get you in at 9 o'clock in the mornings, so then you're not sitting around waiting and you can just come straight in, have your physiotherapy appointment, we can do what we need to do, and then you can go to work. How does that sound?
Yeah, that sounds much better because today I got in and I had to drive in, so getting in and out of the car really hurts.
Okay.
And then once I get here, I've got to walk in, which is also aggravating. But then once I sit down, I'm sitting for ages because we have to wait a bit for everyone else. So if I get in really early, that'll be good. Yeah.
All right. How about on your way out, if you want to see Stephanie about making an appointment, and tell her to book you in for the first appointment at 9 o'clock.
Yeah.
And if you could make that for, say, next Wednesday,
Yeah.
and come in. Now you have no problems getting here. You said you're driving, so that's
Yeah, I
okay.
drive. Yeah.
All right, no worries. So we'll get you in at 9 o'clock. So you're out at 10. Okay. So if you'd like to do that, it's nice to meet you today, Mary.
It was nice
And
to meet you
I look
too.
forward to seeing you next week.
Thank you so much.
No worries. Thank you.
Whew.